My name is Paul Conslato. I'm a practicing internist with the Lancaster General Health Physicians and act as their medical director.
Conslato says many healthcare providers are now placing more emphasis on patient outcomes rather than the number of patients they treat or the cost of their visit.
I think we're re-looking at what we reward and incentivize and reimburse, and I think we as a nation and a community are looking at that more than just the value of a very high-priced imaging study that might not add value to a patient's health or other services that don't have value.
Really? Okay, it seems like quite a bit.
It goes from just, as some say, just getting paid for a widget and delivering a widget to getting paid for something more meaningful around something called the triple aim. Better clinical outcome, better experience for the patient, and at a better cost.
There are certain criteria healthcare providers must meet, especially if they treat Medicare patients, and there are penalties for not meeting them.
The penalties in place for the hospital right now center around readmissions, where hospitals are being penalized from Medicare for excessive readmission rates, in addition to performance around core measures, clinical areas, as well as patient satisfaction scores. That's affecting hospital reimbursement today. There are incentives as well as penalties. In the outpatient world, your physician office, there are minimal penalties right now. There are more incentives in place, although we're seeing these penalties start to creep into the physician practices.
In a few years, the Affordable Care Act will implement more severe reimbursement penalties for healthcare providers that don't adhere to certain outcome-based standards.
2015 is a game changer where we'll see this value-based payment modifier in place for almost all physicians, inpatient and out, and that's where the environment clearly changes, that reimbursement we'll see for the first time for all physicians really moving at least the next big step from static reimbursement to performance-based reimbursement.
Conslato says there are certain ways to help make sure patients are getting the best care possible.
A significant component and a very positive component is this team-based care, where it's just not all about the physician delivering care to a patient. It's about this healthcare team where the physician is the leader of this team. Now nurses, medical assistants, pharmacists, social workers, care managers, roles are being redefined to deliver care, to redefine our delivery model to deliver more comprehensive care, as opposed to hoping your physician had a good day in the office and knowing that everything rested on one person's abilities. Now we have in place that our practices are now being notified within usually real time when a patient is discharged. They are risk stratified at the time of discharge. So we understand, is this a high-risk patient to be readmitted? So there's a prospective component to it. Our teams are now reaching out to that patient within 48 hours, and there's certain documentation that we do and our care managers do with those high-risk discharges to run through their medications to make sure that there were no socioeconomic barriers to the transition, and we place them in our practices for a follow-up visit within 7 days. So with that type of discipline now, compared to yesterday where the patient went into the hospital, we didn't know they were discharged, we didn't know they were having all these challenges making the transition, buying their medications, understanding the needed follow-up required, and with no other knowledge or resources, they just returned to the emergency room. And that happened too often. And through systems and processes, we're seeing that, we're bending that particular metric already.
Conslato says electronic health records are also helping to improve care.
A patient won't have a paper chart at 5 different practices. They'll have one chart that's theirs, and it's not the physician's medical record, it's the patient's, and that's the power of the EHR that we all contribute to in developing one unified plan of care.
Conslato says this changing system will only succeed if patients are connected to their physicians.
It sounds corny, but it's a powerful tool that I think will make or break a lot of redesign efforts that are happening right now. If we're not very conscious and engaged with our patients with all of our transformation, if we don't understand that that they should be in the center of all of our decisions, we'll likely falter. But I'm confident that most physicians and healthcare teams are putting the patient in the middle and understanding what our patients think about all this transformative activity and making sure they understand their role, and their role is critical. It gets to a healthier society. It gets to a healthier population, which in and of itself starts to lower healthcare costs and lowers disease burden, and then we get more health and less health care.